Alzheimer's disease is a neurological condition in which the death of brain cells causes a decline in thinking skills and memory. There is currently no cure, but there are ways to support a person through medication and other strategies. The condition usually affects people aged 65 years and over, with only 10% trusted source of cases occurring in people younger than this. What is Alzheimer's disease? Alzheimer's disease is a condition that affects the brain. The symptoms are mild at first and become more severe over time. It is named after Dr. Alois Alzheimer, who first described the condition in 1906. Trusted source. Common symptoms of Alzheimer's disease include memory loss, language problems, and impulsive or unpredictable behavior. One of the main features of the condition is the presence of plaques and tangles in the brain. Another feature is a loss of connection between the nerve cells, or neurons, in the brain. These features mean that information cannot pass easily between different areas of the brain or between the brain and the muscles or organs. Symptoms. Alzheimer's disease is a progressive condition, meaning that the symptoms get worse over time. Memory loss is a key feature, and this tends to be one of the first symptoms to develop. The symptoms appear gradually, over months or years. If they develop over hours or days, a person may require medical attention, as this could indicate a stroke. Symptoms of Alzheimer's disease include memory loss. A person may have difficulty taking in new information and remembering information. This can lead to repeating questions or conversations, losing objects, forgetting about events or appointments, wandering or getting lost. Cognitive deficits. A person may experience difficulty with reasoning, complex tasks, and judgment. This can lead to a reduced understanding of safety and risks, difficulty with money or paying bills, difficulty making decisions, difficulty completing tasks that have several stages, such as getting dressed. Problems with recognition. A person may become less able to recognize faces or objects or less able to use basic tools. These issues are not due to problems with eyesight. Problems with spatial awareness. A person may have difficulty with their balance, trip over, or spill things more often, or they may have difficulty orienting clothing to their body when getting dressed. Problems with speaking, reading, or writing. A person may develop difficulties with thinking of common words, or they may make more speech, spelling, or writing errors. Personality or behavior changes. A person may experience changes in personality and behavior that include becoming upset, angry, or worried more often than before. A loss of interest in or motivation for activities they usually enjoy. A loss of empathy. Compulsive, obsessive, or socially inappropriate behavior. In 2016, researchers published findings trusted source suggesting that a change in the person's sense of humor might also be an early symptom of Alzheimer's. Stages. Alzheimer's disease can range from mild to severe. The scale ranges from a state of mild impairment, through to moderate impairment, before eventually reaching severe cognitive decline. The sections below will discuss the stages of Alzheimer's trusted source and some of the symptoms that characterize them. Mild Alzheimer's disease. People with mild Alzheimer's disease develop memory problems and cognitive difficulties that may include the following: taking longer than usual to perform daily tasks, difficulty handling money or paying the bills, wandering and getting lost, experiencing personality and behavior changes, such as getting upset or angry more easily, hiding things, or pacing. Moderate Alzheimer's disease. In moderate Alzheimer's disease, the parts of the brain responsible for language, senses, reasoning, and consciousness are damaged. This can lead to the following symptoms: greater memory loss and confusion, difficulty recognizing friends or family, an inability to learn new things, difficulty performing tasks with several stages, such as getting dressed, difficulty coping with new situations, impulsive behavior, hallucinations, delusions, or paranoia. Severe Alzheimer's disease. In severe Alzheimer's disease, plaques and tangles are present throughout the brain, causing the brain tissue to shrink substantially. This can lead to an inability to communicate, dependency on others for care, being unable to leave bed all or most of the time. Diagnosis. To receive a diagnosis of Alzheimer's, a person will be experiencing memory loss, cognitive decline, or behavioral changes that are affecting their ability to function in their daily life. Friends and family may notice the symptoms of dementia before the person themselves. There is no single test for Alzheimer's disease. If a doctor suspects the presence of the condition, they will ask the person, and sometimes their family or caregivers, about their symptoms, experiences, and medical history. The doctor may also carry out the following tests. Cognitive and memory tests, to assess the person's ability to think and remember. Neurological function tests, to test their balance, senses, and reflexes. Blood or urine tests. A CT scan or MRI scan of the brain. Genetic testing. A number of assessment tools are available to assess cognitive function. In some cases, genetic testing may be appropriate, as the symptoms of dementia can be related to an inherited condition such as Huntington's disease. Some forms of the APOE4 gene are associated with a higher chance of developing Alzheimer's disease. Testing for relevant genes early could indicate the likelihood of someone having or developing the condition. However, the test is controversial, and the results are not entirely reliable. Treatments. There is no known cure for Alzheimer's disease. It is not possible to reverse the death of brain cells. Treatments can, however, relieve its symptoms and improve quality of life for the person and their family and caregivers. The following are important elements of dementia care. Effective management of any conditions occurring alongside Alzheimer's. Activities and daycare programs. Involvement of support groups and services. The sections below will discuss medications and treatments for behavioral changes. Medications for cognitive symptoms. No disease-modifying drugs are available for Alzheimer's disease, but some options may reduce the symptoms and help improve quality of life. Drugs called cholinesterase inhibitors can ease cognitive symptoms, including memory loss, confusion, altered thought processes, and judgment problems. They improve neural communication across the brain and slow the progress of these symptoms. 3 common drugs with Food and Drug Administration (FDA) approval to treat these symptoms of Alzheimer's disease are donepezil, Aricept, to treat all stages. Galantamine, Razardine, to treat mild to moderate stages. Rivastigmine, Exelon, to treat mild to moderate stages. Another drug, called memantine, Namenda, has approval to treat moderate to severe Alzheimer's disease. A combination of memantine and donepezil, Namzarac, is also available. Causes. Like all types of dementia, Alzheimer's develops due to trusted source the death of brain cells. It is a neurodegenerative condition, which means that the brain cell death happens over time. In a person with Alzheimer's, the brain tissue has fewer and fewer nerve cells and connections, and tiny deposits, known as plaques and tangles, build up on the nerve tissue. Plaques develop between the dying brain cells. They are made from a protein known as beta amyloid. The tangles, meanwhile, occur within the nerve cells. They are made from another protein, called tau. Researchers do not fully understand why these changes occur. Several factors may be involved. The Alzheimer's Association have produced a visual guide to show what happens in the process of developing Alzheimer's disease. Risk factors. Unavoidable risk factors for Alzheimer's disease include aging, having a family history of Alzheimer's disease, carrying certain genes. Other factors that increase the risk of Alzheimer's include trusted source severe or repeated traumatic brain injuries and having exposure to some environmental contaminants, such as toxic metals, pesticide, and industrial chemicals. Modifiable factors that may help prevent Alzheimer's include getting regular exercise, following a varied and healthful diet, maintaining a healthy cardiovascular system, managing the risk of cardiovascular disease, diabetes, obesity, and high blood pressure, keeping the brain active throughout life. Summary. Alzheimer's disease is a neurodegenerative condition. A buildup of plaques and tangles in the brain, along with cell death, causes memory loss and cognitive decline. There is currently no cure, but drugs and other treatments can help slow or ease the cognitive, emotional, and behavioral symptoms and improve the person's quality of life. At the end, it is requested to please subscribe our channel.